So data is new currency. Customer intelligence will be the most important predictor of revenue and profitability. Technology will be central to creating engaging experiences. Is this a reality in healthcare, or a better question would be, how do we make this a reality in healthcare where data is actually beginning to be used to make those kinds of changes with either predictive models or new experiences?
Yeah, yeah, great question, Bill. I think we're evolving to a data economy. I mean, it's going to be interesting. What is the output of the American economy 20, 30 years from now? Data is going to be a big component of that, and we know that those that work in the data space, in many ways, have a much brighter economic future than those that don't. And so I think, it's translating to a lot of different areas. When we founded Explorus, our whole premise was based upon data, and how data was the real value, and that it could in many ways bend the cost curve if used appropriately. And when I say appropriately, both morally and ethically, as well as just financially in a prudent way. But having spent a lot of time in the financial services sector, I tell you that that's been around a long time as well, and they've learned some very painful lessons. The 2008 financial crisis was really all about a recognition that they weren't leveraging their data as effectively as they should have. And that's why you see now so much emphasis in fintech around things like KYC, or know your customer, the ability to predict and mitigate risk, apply AI to drive those mitigation strategies, address the regulatory requirements that are out there. And I mean, the parallels to healthcare are amazing. I spoke at an event yesterday, a fintech event yesterday, and this is what came up. And it's interesting, they actually used healthcare as an example where they need to start thinking in terms of patient privacy and protection of information and whatnot. So these markets are so interconnected. I think, I think information is absolutely critical. What's ironic that one of the major reasons why people have health issues is stress. And so they go in front of their doctor and they tell them about it. And their doctor prescribes a medication that may be needed for one thing or another, that physician in many cases doesn't know what that's going to cost the patient. It seems like a vicious circle, right? The patient gets home and finds out that their copay or that drug's going to cost him $500. And they wind right back up at the doctor's office again. So we need to think about our data. We need to put better data in front of our practitioners, better data in front of our of the patients. That's going to be critical to this, and I think the organizations that take that really seriously, again, will get rewarded with a new kind of loyalty.